When people think of stroke, they often picture it as a sudden event that comes out of nowhere, striking like lightning in a clear blue sky. But as a neurologist who has spent over 30 years studying the brain, I can tell you, strokes are rarely sudden surprises. In most cases, they are the final straw after years or even decades of silent damage building up inside our blood vessels. However, what truly shocks me is how one seemingly harmless habit can drastically increase your risk of a stroke overnight, especially in seniors over 60. Most people don't even realize they're doing it. It might sound dramatic, but by the time you finish this article, you'll understand how urgent it is to stop this habit immediately. In the United States alone, nearly 800,000 people suffer a stroke each year. It's the fifth leading cause of death and a major cause of long-term disability. Many seniors fear cancer or heart attacks, but strokes often go unspoken, despite being even more devastating in some cases. A stroke occurs when blood flow to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. Once those brain cells are gone, they can't be replaced. The most common type is an ischemic stroke caused by a blocked artery. The less common but deadlier hemorrhagic stroke happens when a blood vessel in your brain bursts, leading to internal bleeding. Both are medical emergencies and require immediate treatment. But what if I told you that one specific habit can push your stroke risk through the roof overnight? That's right, it's not just smoking, poor diet, or lack of exercise, though those are all huge risk factors. One of the most overlooked and underestimated threats to your brain health is poor sleep hygiene. Sleep hygiene doesn't just mean how long you sleep. It also involves when you sleep, how deeply you sleep, and what habits you follow before bed. Studies show that seniors who sleep less than 6 hours or more than 9 hours per night have a significantly higher risk of stroke. But the problem isn't just about duration, it's about quality. Here's why. During deep sleep, your blood pressure naturally drops. If your sleep is frequently interrupted due to bathroom trips, loud noises, or sleep apnea, your body doesn't get that restorative drop. Instead, it experiences repeated spikes in blood pressure, which can damage blood vessels and promote clot formation. Sleep apnea, a condition where breathing repeatedly stops during sleep. It's extremely common among seniors, but often undiagnosed. Every time your oxygen drops, it triggers stress responses in your body, leading to higher blood pressure and inflammation. Research suggests sleep apnea can increase your stroke risk by as much as 300%. Going to bed and waking up at random times throws off your body's circadian rhythm. This disruption can affect everything from your blood sugar to cholesterol levels, making your arteries more vulnerable to plaques and clots. Deep sleep is when your brain cleans itself using a system called the glymphatic system. Without sufficient deep sleep, toxic waste builds up, increasing inflammation and damaging blood vessels. Seniors often fall into the senior sleep trap, napping too much during the day, going to bed too early, waking up too often at night, watching TV or using screens in bed. They think I'm just getting old. This is normal. But fragmented, poor quality sleep isn't normal. It's dangerous. I've seen countless seniors come into my office after a minor stroke or transient ischemic attack, also called a mini stroke. They always ask, "Doctor, how did this happen? Thought I was healthy." Then, after detailed questioning, I discover they were up half the night watching TV, snacking at 2 a.m., or using their smartphone in bed. Their sleep patterns were a mess. One patient, Mr. Thompson, 74, used to go to bed at 10 p.m., but would often wake at 1 a.m. and scroll on his tablet for hours. One morning, he woke up unable to move his right arm and could barely speak. Thankfully, he got to the hospital in time, but he still struggles with weakness today. When you deprive your brain of good sleep, you activate your body's fight or flight stress hormones repeatedly. This causes higher blood pressure overnight, increased heart rate variability, blood clotting changes, and inflammation of blood vessels. Just one night of very poor sleep can temporarily increase stroke risk, and in seniors with already weakened vessels, that's enough to trigger a catastrophic event. After a minor stroke, Many seniors actually sleep even worse due to anxiety, medications, or fear of another stroke. This poor sleep then increases the chance of another, often more severe stroke. Breaking this cycle is critical, and it starts by taking sleep seriously as diet, exercise, and medications. Here's a simple checklist I give to my patients to improve their sleep and protect their brains. Go to bed and wake up at the same time every day, even on weekends. Avoid screens, TV, phones, tablets at least 1 hour before bed. Keep your bedroom cool, dark, and quiet. Avoid large meals and caffeine close to bedtime. Get morning sunlight exposure to regulate your circadian rhythm. Avoid napping longer than 30 minutes during the day, and talk to your doctor if you suspect sleep apnea, loud snoring, gasping at night. Many seniors reach for sleeping pills, thinking they're the easy solution. But most common sleep aids, even natural ones, can increase confusion, falls, and even stroke risk in older adults. If you struggle with sleep, it's far better to work on behavior and lifestyle changes first. Nutrition plays a crucial role in sleep quality. Seniors should focus on magnesium-rich foods, leafy greens, nuts, seeds, tryptophan-rich foods, turkey, dairy, and omega-3 fatty acids, salmon, walnut. These support the production of melatonin and serotonin, essential for healthy sleep patterns. Chronic stress can ruin your sleep. Activities like gentle yoga, meditation, tai chi, or simply deep breathing before bed can help your body wind down naturally. When you're younger, you can bounce back from an all-nighter. But as we age, our blood vessels lose elasticity and our brains become more vulnerable to oxygen changes. A single bad night might be enough to tip the scales and cause a stroke. That's why I tell my senior patients, your brain needs sleep, like it needs oxygen. Treat it as a medical necessity. It's not a luxury. The good news is, it's never too late to improve your sleep and lower your stroke risk. In many cases, even small improvements in sleep hygiene can significantly reduce inflammation, stabilize blood pressure, and improve brain health. Patients who commit to better sleep often see improvements in memory, mood, and overall energy level. And most importantly, they reduce their chances of facing a life-altering stroke. I've been practicing neurology for decades, okay? And I've seen the devastation of stroke firsthand, patients losing their independence, families torn apart, lives changed forever. I wouldn't wish a stroke on anyone, especially not when it can be prevented. So tonight, before you crawl into bed, ask yourself, did I respect my sleep schedule today? Did I protect my brain by avoiding screens and stress late at night? Am I taking my sleep as seriously as my diet or exercise? Brain will thank you, and your loved ones will too. Sleep well, protect your brain, and stay independent, strong, and vibrant for years to come.